Yes, today we are going to be looking at valve regurgitations, that is on echo. Remember, we have in the heart, if I can draw a simple heart here, 4 chamber, yeah? Okay, sorry. 4 chamber, we have so many valves, 4 of them. The mitral valve, and then the tricuspid valve, and then we have the aortic valve, and then pulmonic valve somewhere there. Remember the function of the valve, they act as doors, yeah? They are supposed to allow unidirectional flow. Just to allow unidirectional blood flow. Unidirection. If it is supposed to pass just like this, it pass, but no going backwards, yeah? This direction, it shouldn't happen backwards. In the heart, we know that blood is always coming from pulmonic vein, if we are talking of the left side, from pulmonic vein, and then to left atrium, and then to LV, and then to aorta. In the right side, it is coming from SVC, and then the IVC, into the right atrium, and then from right atrium to right ventricle, and then to RVOT. That's what we know. So the unidirectional flow there, it is blood from SVC O and the IVC, that is the cover system, and then to right atrium, and then to left to right ventricle, and then to pulmonary artery, and then to lungs, and then to pulmonary veins, to LA, and then LV, and then aorta. That's what we know. That's the unidirectional flow. So where are the valves? The valves are at this junction here. We have tricuspid valve, and then at this junction here we have mitral valve, and then at this junction we have aortic valve, and then at this junction we have pulmonic valves. We have these ones. So this valve, meaning this valve, it allows blood to RV, then this one blood to LV, blood to aorta, and then blood to pulmonary artery. This, if it happens in this way, this is called forward flow. Forward flow. Blood is flowing in its normal direction, the direction it's supposed to take. What is regurgitation? We have 2 main diseases of the valves, just as a reminder. Valvular diseases, there are mainly 2. I will mention here. We have stenosis and then regurgitation. Stenosis and regurgitation. What is stenosis? The valve, it is always acting like a door. For example, if this is mitral valve, when blood is passing, they are always pulling on the sides. They give way then to open the valve. If the ventricle is contracting, then they are always closing. This is an open valve, this is closed valve, so that if blood is to go this side, it cannot pass going this side. You understand? When it's open, it allows forward flow. When it closes, it prevents back flow. So no backflow, and then forward flow. So this one is valve cannot open properly. That is stenosis. And now here valve cannot close properly. The valve does not close properly, the valve does not open properly. So it does not open properly, less space is there for blood to pass. So restriction of forward flow. So this one, forward flow restricted. Then if it cannot close properly, then backflow occurs. Backflow occurs. So here again, if we are to draw our heart, simple heart, these are the atria, this is TV, MV. These are open. So in a diastole, this is diastole, diastole or relaxation. Yes, diastole or relaxation. This thing happens in relaxation. So valves are open. Remember cardiac cycle. If you didn't watch that lecture on cardiac cycle, you have to go back. But here I'm just going through very fast. Relaxation, valve open. So in contraction, it's still a simple heart. Relaxation, simple heart. Again, we are drawing. These valves are open valves. These are closed valves. Yeah, so closed valves. So this is systole. That is ventricular. I can add ventricular systole. So if this ventricle is contracting, blood should go to aorta or pulmonary artery. And now these valves should close, that ventricular valves, that is tricuspid valve and mitral valve, should close to prevent blood from going back. It shouldn't happen. So if it happens, this is regurgitation. That was just to tell you about regurgitation. So what is next now? What is next? So for us to detect that backflow, because regurgitation is not normal, as we have seen, they should close properly. If they don't, for example of a regurgitant valve, for example tricuspid valve is closing very well. Sorry, this power is disturbing. Power is going on and off, so sorry for that. Mitral valve, it is incompetent or insufficient. So this is systole. We know the valves should close, but mitral valve does not close properly. So what do we expect? We expect some blood to continue to aorta, but some to go back to LA. And this will be mitral regurgitation. MR, that's how we call it. Mitral regurgitation will be there. So on echo, that is 2D or 2D transthoracic or transesophageal, all of them, they are good for diagnosing and quantifying regurgitations. Echo is good at doing this one. So we are going to see how we're going to diagnose regurgitations on echo. Diagnose on echo. So on echo, what we are going to do, we are going to use something called, we have different echo modalities. We have 2D, just remind you, 2D echo. We have Doppler echo. So these ones, it is many M mode. You have M mode also, can put it. Bright B mode, not so much. So our thing, and then 2D or 3D. Our thing is this Doppler is going to be divided into spectral and then color. So we are going to focus on, for these regurgitations and what, we are going to focus on color Doppler. I will make another video for Doppler shift or Doppler effect to talk about that one. So we are going to focus on color Doppler. Color Doppler is about studying just directions of blood flow using frequencies. Yeah. So this color Doppler, there are two colors, red and blue. Red and blue are there. These colors can be changed. You can change the settings to remove red and blue, and you name it our other colors. But normally we use red and blue. And then there is this thing you will see. If you use this one, there is something called the BART rule. The BART rule. What is B? B is blue, as I've named here, color. A is away. T is red, as I named it here. And then this is towards. Blue away, red towards. So blue away, red towards. That is get it like that, the BART rule. Most machines, they use this one. Anywhere you will find these colors, these two colors. Blue away, red towards. Remember the views. The views, how we make the views, we have 4 parasternal views. Apical, suprasternal, and then subcostal. Parasternal, apical, what? Remember, long axis, short axis. So depending on where you have put the transducer, parasternal just near the apex can be right parasternal or left parasternal. But now here we're talking of more of left parasternal. Apical, just in the apical impulse. You palpate, you get the apex bit of the heart, you put the probe there. And then image orientation on the screen, like in 4-chamber, apical 4-chamber, that is apical 4-chamber. There are many, I've not named it here. Apical 4-chamber, when the probe is at the apex, whatever comes near the probe, you will see it first. So in apical 4-chamber, we shall see something like this, because you have put the probe on the apex. This is probe or transducer. You have put it near the apex. So what comes first? They are the ventricles, and then from there we get the atria. So these are atrias, these are ventricles, these are atrias. Yeah, this is the 4-chamber atrias and ventricles. If you do 4-chamber and you have not changed your image orientation on the screen, it will appear like this. Meaning, when you put the probe at the apical impulse, you see the apex first, and then you go up the heart as you follow. So, if you remember the blood flow, normal blood flow, if, for example, if this is the right ventricle, right atrium, left atrium, and then left ventricle. Yeah? So if this is the mitral valve, tricuspid valve, where is the normal blood flow is going? From atria to ventricle, meaning in this direction, blood will be flowing in this direction. This direction is normal flow. Normal flow, it is going towards the transducer. We said blue away, red towards. Blue away, red towards. So normal in this orientation, image orientation, normal blood flow is from atria to ventricles, meaning it should be from right atrium, left atrium into right ventricle and left ventricle respectively. Meaning, if you follow this BART rule, blue away, red towards. This blood, if you press on the echo machine, color, and then you choose the sector where you want it, because when you press color, a dialog box will come, just like this. It can come. It will come. You can position this anywhere on the valve you want, maybe mitral valve, tricuspid valve, and then you change its size. You can change it to be like this. You can change it to be like this. You can change it anyhow. You can change the shape, so you can change it to be like this. This color box, you can get it. So this one is the color box. This color box, you can change it to assume any shape. If I want to measure this, to see this, I will make it longer. If I want to, like in a Plaque's view, I will make it like this, because the mitral valve is here and the aortic valve is here, so it has to be like that. It can be changed. I will show you. When I go to the machine. So, direction, back to the direction of blood flow. Blood, normal flow, it should be red towards. Towards what? Towards the probe. Again, towards the probe or away from the probe. You understand? It is either towards the probe or away from the probe. So in this case, normal flow, we should see red color. In this case, we should see red color moving from atria to ventricles when color Doppler is applied. You should see this red color moving from atria to ventricles when red color is applied. Normal flow. In case there is regurgitation said it is backflow. So regurgitation, when the ventricles start contracting, any of these valves will not close properly, and some blood will try to leak. I don't have blue pen, but just follow. Some blood will try to leak outside. For example, mitral valve, blood will leak during systole, ventricular systole, into the left atrium when the mitral valve is incompetent or it is regurgitant. And that one, we say blue away, red towards. Normal direction, red was towards the probe. And now, if there is regurgitation, we should see blue away. Blue color is going away from the probe. Blue color will be seen moving from LV to LA if mitral valve is regurgitant. If mitral valve is regurgitant, blue color will be seen moving away from LV to LA, because following this rule, blue away, red towards. So whenever you are there, maybe you are learning, the doctor or any other person is doing echo, and you see that color, they apply color, you see color in the image like this, you see color moving. Now your goal is to see, is it on the valve? Yes. If it's on the valve, then you see, do I have blue? Because what we expect, if there is no regurgitation, for example, blue is always confined. If no regurgitation, as far as mitral valve is concerned, blue is this side and red this side. But because there is no more blood flow, red will be going this side. And since there is no regurgitation, for example, no blue should close coming this side. The moment you see blue this side, it shouldn't be there. The moment you see blue this side, it is regurgitation. We have to make sure you see whether it's passing here. And you make sure that the color box is only on mitral valve, and you see the color this side. Yeah? So this one, this one, it will be regurgitation, normal. If we need regurgitation, we shall have red in its normal direction going this side, fine. And now during systole, we shall have blue closing this side, and then that's when we see blue this side. The only time we see blue in atria, as far as fourth chamber is concerned, is when we have regurgitation. It's only when we have regurgitation. If we don't have regurgitation, then blue should not be here. It should only stay here and instead be moving to aorta. Blue should be moving to aorta because it is blue away. Now blood will be leaving LV to aorta. Aorta is always going this side, so it will be going this side. So that is an introduction to BART rule or color Doppler. So next video we shall talk about more on regurgitation, and we see, when I get time to go to the echo room, I'll show you what live examples. Yeah, I'll show you live examples. For now, it is that one. You just have to go back and read the cardiac cycle properly, because most of the things I'm saying, they are cardiac cycle. And also go back and watch those videos on physiology and anatomy, because again, whatever I'm talking about is physiology and anatomy. Thank you.